If your dog keeps licking one paw, do not assume it is harmless grooming. And if your dog licks all four paws, the meaning may be completely different. That single pattern can help separate a local injury from a broader skin problem, but many owners miss it until the paw is already sore. Today, I'll show you how to read that pattern, which clues matter most, what you can safely do at home, and when your dog needs veterinary attention. I'm Dr. Ivy, a licensed veterinarian, and I want to make paw licking less confusing for you. Dogs occasionally lick their feet during grooming or before settling down. A few licks are not concerning. What matters is a change from normal. Licking that becomes frequent, intense, difficult to interrupt, or focused on the same place. The location matters too. Before you reach for a shampoo, cream, supplement, or allergy remedy, pause and answer one question. Is your dog licking one paw, two paws, or all four? Before we continue, comment. Is your dog licking one paw, two paws, or all four? Write one, two, or all four, nothing else. That simple answer can point toward very different possibilities, and in a moment, you'll understand why the number of paws matters so much. A quick way to judge intensity is to redirect your dog. Normal grooming usually ends easily, and the dog returns to whatever they were doing. Concerning licking resumes immediately, wakes the dog at night, leaves the fur wet, or progresses to chewing. You may find saliva marks on bedding or hear licking from another room. Do not scold your dog. That can increase stress and hide the symptom without solving it. Record a short video so your veterinarian can see how often it happens and how your dog holds the body. Let's begin with one paw. When licking is suddenly focused on a single foot, I first think about a problem located in that paw. Your dog may have stepped on a thorn, splinter, sharp stone, piece of glass, or grass on. There may be a small cut, cracked pad, insect sting, torn nail, or irritation between the toes. These problems can be easy to miss because the top of the paw may look normal. The clue may be limping, pulling the paw away, licking immediately after a walk, or repeatedly targeting one toe. If your dog is calm and will let you look without struggling, compare the affected paw with the matching paw on the other side. Check the pad surfaces, the spaces between the toes, the nails, and the skin around each nail. Use good lighting. Look for redness, swelling, moisture, blood, discharge, a broken nail, a bump, or something visibly stuck near the surface. Do not squeeze a painful lump or dig into the skin with tweezers. A grass on or other sharp object may travel deeper, and probing can make the injury worse. Pain can also make even a gentle dog bite, so stop if your dog resists. One paw licking can also point to an infection or an inflamed nodule between the toes. You may notice a red bump, swelling, hair loss, drainage, an unpleasant odor, or brown saliva staining. Bacteria or yeast may be involved, but the appearance alone cannot reliably tell you which organism is present or whether infection is the original problem. Allergies, friction, abnormal paw structure, embedded hairs, and foreign material can all damage the skin and allow secondary infection to develop. This is why repeatedly treating the surface without finding the trigger often produces only temporary improvement. There is another one paw clue owners sometimes overlook: pain that is not actually in the skin. A dog may lick over a painful toe, wrist, joint, or lower limb. Arthritis, a sprain, nerve-related discomfort, or another joint problem can trigger licking even when the paw looks fairly normal. Watch for stiffness after rest, reluctance to climb stairs, reduced play, limping, or sensitivity when the leg is handled. A persistent lump or an area that repeatedly develops a sore also deserves an examination. You cannot identify most paw lumps accurately from appearance, so do not wait for one to grow before mentioning it to your veterinarian. Now let's shift to multiple paws, because this is where the pattern changes. Two paws require context. Matching front paws or all four paws may fit itchiness or contact irritation, while two paws on the same side could still reflect separate local problems or changes in movement. The pattern is a clue, not a diagnosis. When licking affects several feet for weeks or months, itchiness moves higher on the list. Environmental allergies can affect the paws, and some dogs flare seasonally while others have signs year-round. Itchy ears, head shaking, face rubbing, or a red belly strengthen that pattern, but several conditions can look similar. Food allergy is possible, but it should not be diagnosed by guessing, frequently changing foods, or relying on an over the counter test. When veterinarians truly investigate a food reaction, they usually use a carefully controlled elimination diet for a defined period, followed by a planned food challenge. Every treat, flavored medication, chew, and table scrap can affect that process. Food is also not the only explanation for year round licking. Fleas, mites, contact irritation, bacterial or yeast overgrowth, and other skin disorders must be considered. A dog can even have more than one problem at the same time. Contact irritation often affects the surfaces that touch the ground. Think about what changed before the licking began. Floor cleaner, lawn treatment, road salt, dicer, hot pavement, rough terrain, or a new walking route. If several paws became irritated soon after a known mild exposure, rinsing them thoroughly with lukewarm water and drying carefully between the toes is a reasonable first step. But if you suspect a chemical burn or toxic substance, contact your veterinarian or a pet poison service promptly rather than experimenting with neutralizing products. Some chemicals cause continuing tissue damage, and licking may increase exposure through ingestion. But here is the mistake that can turn mild irritation into a painful cycle, allowing the licking to continue while waiting for the cause to reveal itself. Saliva and friction keep the skin damp, weaken its protective outer layer, and create tiny injuries. That inflammation encourages more licking. Bacteria or yeast may then multiply, adding odor, redness, discharge, and more discomfort. By the time you notice stained fur, both the original trigger and an infection that developed afterward may need attention. Stopping access does not diagnose the cause, but nonstop licking can make recovery harder. What about boredom or anxiety? They can contribute to repetitive licking, but behavior should not be your first conclusion when a dog suddenly fixates on a paw. Itch, pain, parasites, infection, injury, and nerve-related discomfort need consideration first. Behavioral licking may occur in predictable situations, such as when the dog is alone or unable to settle, and it can become a habit. Even then, chronic licking can create a thick, irritated sore called a lick granuloma. Effective care may require both a medical evaluation and a thoughtful behavior or enrichment plan. At home, focus on observation, protection, and avoiding accidental harm. Note when the licking occurs, which paws are involved, whether it follows walks or meals, and whether it changes with the season. Take clear photos before cleaning the area, because the appearance may change by the time of an appointment. Keep the paws clean and dry. If your dog is damaging the skin, a properly fitted Elizabethan collar may temporarily prevent access while you arrange care. It does not replace diagnosis, and any device must allow safe breathing, drinking, movement, and supervision. Please avoid hydrogen peroxide, alcohol, essential oils, concentrated vinegar, harsh disinfectants, and random human creams. These may sting, damage healing tissue, cause toxicity if licked, or make examination more difficult. Do not give human pain relievers. Several common products can be dangerous for dogs. Do not start leftover antibiotics, antifungals, steroids, or allergy medication without veterinary guidance. Even a familiar medication may be inappropriate for your dog's current condition, weight, age, or other medicines. And avoid tightly wrapping a paw unless a veterinary professional has shown you how. Swelling and moisture can become trapped beneath a bandage. So, when should you seek help quickly? Contact a veterinarian promptly for a deep cut, uncontrolled bleeding, a puncture, a badly torn nail, an embedded object marked swelling, pus, a foul odor, severe pain, or refusal to bear weight. Burns, suspected toxin exposure, rapidly spreading redness, or tissue that looks dark, pale, or damaged also need urgent guidance. Seek immediate care if your dog seems weak, collapses, has facial swelling, develops widespread hives, vomits repeatedly, or has trouble breathing. Those signs go beyond an ordinary itchy paw and may indicate a serious allergic reaction or another emergency. If licking is mild but continues, keeps returning, disturbs sleep, causes hair loss, or involves several paws, schedule an examination rather than cycling through home remedies. Your veterinarian may examine the skin and nails, check for parasites, look at cells collected from the paw under a microscope, or recommend additional testing based on the pattern. Allergic skin disease is diagnosed step by step because no single test explains every itchy dog. The goal is not merely to suppress licking, it is to identify and manage the combination of triggers, infection, inflammation, and pain affecting that individual dog. Your timeline can be useful. Write down the first day you noticed the problem and what happened beforehand, including grooming, boarding, travel, swimming, medication changes, diet changes, or long walks. Note whether flea and tick prevention is current and whether other pets or people in the home are itchy. These details help your veterinary team prioritize possibilities and choose tests efficiently. They also reduce the chance that a recurring pattern will be forgotten after the paw temporarily looks better. A note can reveal whether the problem is seasonal, environmental, progressive, or linked to activity. Treatment, therefore, depends on the cause. A superficial irritant needs a different plan from a foreign body, a torn nail, mites, a bacterial infection, yeast overgrowth, joint pain, or environmental allergy. Some dogs need short-term treatment. Dogs with allergic skin disease may need a longer management strategy and follow-up when flares occur. Improvement may not be perfectly linear. If a treatment helps briefly and the licking returns, that does not automatically mean nothing worked. It may mean a secondary infection improved while the underlying trigger remained, or that a new flare has begun. Before we finish, remember the pattern. One suddenly targeted paw makes a local problem: injury, foreign material, nail damage, focal infection, a lump, or pain, especially important to investigate. Several itchy paws raise concern for a broader skin issue such as allergy, contact irritation, parasites, or infection, although exceptions exist. Then look beyond the paw. Ears, belly, gait, season, recent walks, new household products, and changes in behavior. These clues cannot provide a diagnosis at home, but they can help you describe the problem clearly and get your dog the right care sooner. If you commented 1, 2, or all 4 earlier, now add how long the licking has been happening: days, weeks, or months. That second detail completes the pattern and may help other owners recognize what is worth tracking. Subscribe for more calm, practical pet health guidance. Most importantly, do not blame your dog for licking. Whether the trigger is itch, pain, irritation, or stress, persistent licking is information. Your job is to notice the pattern, protect the skin, and seek help before the cycle becomes harder to break. This video provides general educational information and cannot diagnose your dog or replace an examination by a veterinarian. Paw licking has many possible causes, and the safest next step depends on your dog's symptoms, medical history, and physical examination. Contact your veterinarian for persistent or worsening licking and seek urgent care for severe pain, significant injury, suspected poisoning, facial swelling, collapse, or breathing difficulty.